Thank you for coming back, everybody. This is the support group and counselling session, and we are delighted that we have so many fantastic partners that we work with. This is certainly not purely a genetics department and University of Leicester show. This is very much about all the people who are experts in cancer, familial cancer, and the impact on families. And it's an enormous pleasure to invite Wendy Watson to talk first, OBE, I think, as well, and Tesco Mum of the Year 2011 to talk to us about inherited breast cancer and support groups. And then we'll go on and talk about prostate cancer. Over to you, Wendy. Thank you so much for coming.
Well, it's actually a great delight to me to be able to come here, and it's actually recognised there are people here talking about preventive, risk-reducing mastectomy, oophorectomy and all the rest of it, because when I first started this journey, I was very much on my own. Probably 40 years ago, when my mum died, I was concerned about the inherited factors because of her mum as well having breast cancer in both breasts. But I was always told there was no such thing. And luckily, I moved to the Peak District in 1990, and I met up with some of my mum's relatives who told me that, in fact, we had a lot more relatives than just my mum and my grandmother. And so I came to the conclusion that the only thing I could do would be to, well, I went to the new GP and said, please don't tell me it's not hereditary, because I'll say I don't believe you. And of course he looked at the family tree of 9 relatives and said, yes, this is an enormous family history. So I thought, well, at least somebody's recognised that. And so in the end, he used to check me frequently. There was nothing else on offer, no mammograms. Tamoxifen was just starting its trial, but I was too young, in my mid-30s then, to go on the trial. And as we've heard, the side effects weren't suitable for somebody of my age. And in the end, I came up with the idea that if I had surgery before I developed breast cancer, would that actually prevent me from getting it? Well, if I'd have said I've decided to grow 2 heads in case one of my brains doesn't work very well, I don't think that would have been treated in any more strange, any more ludicrous way than what I had to offer or suggest. And, that was the difficult bit. Was actually having the time to explain to people how I'd come to this conclusion for myself, and I'm not saying it would be right for everybody, but for myself it was absolutely the right thing, of what I could do to prevent myself from developing it. 9 relatives out of 10 was just horrendous to me, and I'm somebody that likes to get on with life and not have things put in my way. So eventually I did manage to get a referral, and I did manage to get to see a surgeon who nearly fell on the floor when I suggested that I would like to have surgery. And he said that he spends most of his time sort of talking to patients and saying, really is the best thing, and the patients are saying, please will you save my breast? And he said, you're doing the opposite, there's nothing wrong with you and you're asking me to take them. But I'm not here to talk about this angle, but I wanted you to get to this because this is where the support groups come in. The whole thing is very isolating for people who have to explain to others why they are seemingly healthy at the moment, but are looking to take steps to prevent themselves from getting any illnesses in the future. Most people, it's a kind of like a friendly thing that they do. They try and reassure you and say, well, it won't happen to you. And it's meant to reassure you. And it's meant to be a kindly thing to do. But those people don't realise what they've actually done is they've actually closed the door to any further discussion about the thing that's concerning that person. So I determined, and it didn't happen to me because I've got a wonderful family and I'm quite a strong-minded person, so I was quite happy to explain to people why I was doing what I was doing. But I realised that this was a real difficulty for some to actually cope with. So I did a lot of publicity, and eventually I was asked by the health minister to set up the Hereditary Breast Cancer Helpline, which I did in 1996. And as a natural progression, we've now set up 37 support groups across the UK. We have one in most areas, and they are manned by trained volunteers who have probably been through the helpline themselves, who've used the helpline, have gone through whatever they've decided to do, be it go on preventive trials, drug trials, or have surgery, or just do nothing, because that is an option, and just have as regular screening as you possibly can have. But we've tried to get a balanced mixture of people to run the support groups. Now, there's one particular support group that I'd like to talk to you about, and that is the under 25s. Because for them, there's nothing else. Absolutely nothing else. They can go and get a genetic test. Yes, they can. They won't get offered anything after unless they push for surgery. And not many people at the age of 22, 23 would want to push for surgery yet. And yet half of those people may well have lost their mums. The other half will probably have inherited the gene part from the father. So, you know, we do fulfil a marvellous gap there, and we're very well blessed with some good active under 25 group people who, in fact, one actually drove all the way from Cornwall to the last meeting that Julian had here. And another group that we have is for partners and men. And I want you to try and put yourself in this position that the male group has been very much left out of the NHS system. Half of them will probably be supporting their wives going through this and having to make these choices and not knowing what to say, really. And the other half will probably be feeling guilty about having passed a gene on to their children. And what really prompted me on this was I had a lady that did ring the helpline some years ago, and her sister had died at 29 from breast cancer. She was facing the thoughts of having a genetic test. The family had fallen apart. The genetic counsellor had been and told the father that they had now found the fault and it was on his side. He just closed himself off. He couldn't bear anything. He couldn't bear to talk. His wife and him were totally, well, they were communicating, and yet the most gorgeous people ever. And they all came down to my house actually as a family, and he now runs the Partners and Men group. And I think that is a real testament to the human spirit, that after all that he's gone through, losing his daughter, that he's come out the other side and he's now, you know, now helping other people through it, which is wonderful, absolutely wonderful. There's a lot of work still to be done, and we need to keep promoting the support groups. We need the genetic counsellors to give the leaflets out. We really do. We've done, I do have a patient satisfaction survey form, and at the bottom, if there's any comments, 100% of people said that one of the most important things throughout the whole process was having the helpline, and the 24-hour support it offers was one of the most important elements of the whole journey. And some were quite upset that they weren't actually given any details. They were given a genetic test result and then said, well, go away and think about it. And I think in the early days, I think there was a little bit of nervousness amongst genetic counsellors that I might try and persuade everybody to have risk-reducing surgery, which is clearly not the case, as everybody who is involved in it will know. It was right for me, it's been right for thousands of others, but it won't be right for everybody. And so I'm very, very careful about that. But I think the tide is now turning, and I think there's a huge recognition of the fact that people do need support, and they do need to be able to identify with others, because there is only so far that a genetic counsellor can go. They can't actually say how it feels, how you're going to feel the day before the surgery, how your husband's going to react, how you're going to talk to your partners, how you're going to talk to your children, how you're going to go through all that. And there's nothing like being able to talk to a balanced section of the public who've been through that to help you move forward. So there we are. We have the National Hereditary Breast Cancer Helpline, now been running 17 years, 37 support groups. There's leaflets downstairs. Please help yourself. There are quite a few of the support group volunteers, coordinators here in the audience, who I'm very, very grateful to. They turn out every time, and without all the volunteers, I couldn't continue. So, you know, we're now setting up charity shops all over the place in the aim to put hereditary breast cancer on the high street. That should do it, shouldn't it? So anyway, thanks very much for your time.
Has anybody got any questions for Wendy? Fantastic.
Oh, wait a minute.
Is there a support group in Leicester then?
Yes, there is.
And where's it held?
The last time we held it at Lichfield.
Oh, right.
Yeah. And the girls are over there. Michelle, Diane, Sue, are all over there who organise it. We actually had, I don't know if people are on Facebook, but we found that Facebook has been a marvellous tool for us because we have the support groups are active on Facebook and people chat amongst themselves about issues and post things. We've not had any problems whatsoever. So I think that's a good use for social media.
There's another question here.
Do you have any helplines in Newcastle area?
The helpline is a national number and I answer it 24 hours of the day.
Thank you.
But yes, there is a support group in Newcastle and I can put you in touch with people from Newcastle who've been on the training courses. I've held, how long have we held now? Is it 3 or 4? I have to ask Diane because she's chief cook at these events. It's my sister, I drag her in. That's her fault for being BRCA negative. She's got to come and cook at all the training events. Yeah, so yes, we do have Newcastle.
Do you need any bilingual help? Then I'm willing to give my some hours to you. If you need any bilingual
we always welcome any volunteers. Yeah, always welcome every volunteer that we can get.
Because I used to help from the London on a telephone support, you know.
Yeah.
A few years ago, but they lost the money, so I'm not doing
well,
that.
I never had any, I still manage. That's why I'm doing it on my own, but there you go. But yes, we do.
I'll give you my name.
Yeah, do please. Yeah, send me an email or whatever, that would be great. Yeah, look forward to it.
Fantastic. Absolute inspiration. Thank you very much.
Welcome.